Risk comes with being an athlete. It's part of what makes sports challenging. Sometimes there are injuries, but there are unacceptable risks as well, especially when they involve possible brain injury. Continuing to play with a concussion can cause permanent damage or even death.
Okay, let's do it again.
In athletes who play sports, you really can't prevent the first concussion most of the time. You can be careful about playing by the rules and making sure equipment fits correctly, but really, oftentimes the first concussion cannot be prevented. The subsequent issue, however, and the critical issue, is preventing further injury to the vulnerable brain. During the time that an athlete has a concussion, until the brain recovers, they're vulnerable, particularly youth athletes, to further injury.
The first concussion I received was my freshman year in lacrosse. My next concussion was my junior year.
In one study of catastrophic head injuries in high school and college athletes, most of the athletes suffering devastating brain damage had a history of a previous concussion. And most of those previous concussions were in the same season.
Almost 40% of those athletes with deadly consequences were still playing with symptoms. You have to stop sports participation until the signs and symptoms of concussion disappear. This player had a subdural hematoma.
Dr. Stan Herring is co-director of the Seattle Sports Concussion Program. He works closely with coaches and athletes on all levels, both youth and professional.
If a coach suspects a sports concussion in a youth athlete, it is critical that the athlete not return to play or practice.
Part of the problem is that teens may hesitate to report symptoms, believing their injuries are no big deal or trying to tough it out and return to the game. There may even be pressure from parents or other adults to keep playing.
As a coach, sometimes you're going to have pressure from parents to return a younger athlete quickly, and you have to understand that young athletes are not adult athletes, and they will heal slower than adults.
Good, you guys, open up, Andy, more, Andy, wider!
In the state of Washington, there is a law to guide coaches and adult supervisors. It states that a youth athlete who is suspected of sustaining a concussion or head injury in a practice or game shall be removed from competition at that time and may not return to play until the athlete is evaluated by a licensed healthcare provider trained in the evaluation and management of concussion and received written clearance to return to play from that healthcare provider.
A coach removes an athlete with a suspected concussion or a demonstrated concussion from practice or play. After that is done, the decision about return to practice or play is a medical decision. This is not new news. This has been known for a decade, if not longer. The Zackery Lystedt Law just makes this simple. Now it's not just a suggestion, it's a law.
It is absolutely essential for coaches to take the lead in recognizing a possible concussion to prevent potentially devastating brain injuries.
A coach is the first line in being able to see if an athlete has a concussion. They really know their players, they see them every day, and they're a key component to helping identify concussions.
The partnership between coaches and the healthcare community is an essential part of the Zackery Lystedt Law. The coaches have the trust and confidence of the players. The players will listen to the coach. This allows for the right thing, the safe thing to be done.
I just felt really sluggish. I didn't feel like I was moving as fast as I should. And as soon as the match was over, I had a little bit of trouble just comprehending what was going on. I went and I started throwing up in the trash can after I was done.
When you take a blow to the head or to another part of your body with the force transmitted to your head, there's a rapid onset of signs and symptoms, and they can be variable. In technical medical terms, a concussion is described as a complex pathophysiological event to the brain that's induced by trauma. What does that mean? Complex, first of all, it's a complicated cascade of injury to brain cells and the blood supply to the brain. Pathophysiological, it's not structural. This is a software problem, not a hardware problem. The brain looks normal, a CAT scan or an MRI, but the brain doesn't function normally.
When I first stood up, I was just really confused, and
My head didn't hurt, so that was the kind of weird part. I didn't realize that I had had a concussion until the coaches pulled me off the side and examined me. As I sat on the bench and the coaches started asking me questions, it was like, whoa, I don't know. I didn't know what day it was. I didn't know where I was. Didn't know what team we were playing.
You were playing lacrosse and you got hit?
Yes.
Concussions can happen during any sport. As a coach or an adult supervisor, you're the first person to evaluate an injured player for possible concussion.
Do you have a headache?
Just a hit to the head, and couldn't remember anything from that hit, but coaches saw me laughing on the sideline, so they pulled me out and wondered what was going on. And
That gut feeling that you have that something is wrong or their personalities are different, you need to trust that and understand that those are the signs and symptoms that are going to show you that a young athlete has a concussion. You put one foot in front of the other like this. Cross your arms. Close your eyes.
There can be many signs and symptoms of concussion. They vary depending on what part of the brain is involved, and sometimes they can be subtle. Only about 10% of athletes will lose consciousness. Symptoms of concussion are what players tell you they're feeling. Signs are what you observe in an athlete. Athletes may report these symptoms: headache, pressure in head, nausea or vomiting, neck pain, balance problems or dizziness, blurred, double, or fuzzy vision, sensitivity to light or noise, feeling sluggish, feeling foggy or groggy, drowsiness, change in sleep patterns, amnesia, not feeling right, fatigue or low energy, sadness, nervousness or anxiety, irritability, more emotional, concentration or memory problems, confusion, repeating the same question or comment. Signs may include these behaviors: appears dazed or stunned, vacant facial expression, acts confused about assignment, forgets plays, is unsure of game, score, or opponent, moves clumsily, answers questions slowly, slurred speech, loses consciousness, shows behavior or personality changes, can't recall events prior to hit, can't recall events after hit, seizures or convulsions, any change in typical behavior or personality.
So do you know what the score of the game is?
7-5.
7-5, okay. Are we winning or losing?
Winning.
Signs and symptoms of concussion generally show up soon after the injury, but the full extent of damage may not be apparent at first.
For example, in the first few minutes, the athlete may be slightly confused or appear a little bit dazed, but an hour later, they can't recall coming to the stadium. So assess the player, then assess the player again, then reassess the player even later. Make sure that that athlete is supervised for at least 1 or 2 hours after you suspect a concussion.
I got hit and kind of fell down. I wasn't really knocked out. The ref stopped the game and asked if we were okay. We're just kind of, yeah, we're fine. We got up and kept playing. And headaches started getting worse, and I stopped being able to concentrate and stuff. I was like, I think I have concussion.
When in doubt, sit them out.
Even the suspicion of a concussion requires that the coach remove the student from play. The next step is for a licensed healthcare provider who has been trained in the management of sports concussion to evaluate the athlete.
If you can close one eye for me.
Kailani Gilbert, an athletic trainer with Seattle Children's, works closely with coaches and athletes, often on the playing field.
Okay, well, I think you got a concussion, but it's not too bad. And I'm just going to sit you on the sidelines for a little bit, and we're going to keep monitoring you and let you rest, and I'm going to talk to your parents to see how, and kind of talk to them about what's going on.
If no medical personnel are available on site, the coach or designated person needs to decide whether to call for transport to the emergency room or whether to send the player home with adult supervision. Either way, the law requires that a licensed healthcare provider determine when or if to return an athlete to practice or play.
No longer is a coach required to be a coach and a healthcare provider. No longer is a coach put in a position where he or she has to bend to the pressure of an athlete themselves or perhaps an overbearing parent. Return to play after a concussion is a medical decision.
Chase got hit from behind. I came down on the field and said, "Hey, are you okay?" And she said, "Yeah, I'm cool. I'm fine, Mom." And she kept on playing. And then about 10 minutes later, she got hit again.
The long-term effects of a subsequent blow or blows to a concussed young brain can be catastrophic.
Second impact syndrome is a condition that really affects high school athletes the most. Second impact syndrome is when an athlete has a concussion and they return to play too soon, or they continue to play through the concussion. Their brain is in a state of vulnerability, and when they get hit again, there's immediate swelling that takes place in the brain, and it can either cause paralysis, mental disability, or death.
Young brains heal more slowly than those of adults. Rest, minimal physical exertion, and sometimes reduced schoolwork are essential. Returning to sports and other regular activities too quickly can prolong recovery time, sometimes for months.
These are boys and girls who are in school, and concussions not only affect sports performance, they can affect school performance. As a matter of fact, sometimes we have to use what we call cognitive rest. They cannot do their school homework, and they cannot study and concentrate because it prolongs their symptoms, just like premature return to sport does.
Everybody recovers differently from a concussion, and symptoms can last an hour, a day, 2 weeks. A more serious concussion can last 4 months or longer.
Soccer player Chase O'Neal missed 46 days of school as a result of continuing to play with a concussion.
I don't get as many headaches as I used to, but I mean, I still get them. I really do hope to participate in soccer in the fall. I mean, it's my senior year and I kind of wanted to play, but I mean, if I'm not feeling it, then I guess I won't. Just because I'd rather have my brain than have a last year in soccer.
The Lystedt Law makes sports participation safer for all athletes. It's simple. It's now a law. If there's a suspected concussion, take the athlete out. We will prevent tragedies like those tragedies that happened to Zackery Lystedt, and we will help athletes recover faster and return to play and return to their academic performance in a safer, more efficient fashion.
What I'd have to say is don't be worried about being called a wimp because you had a concussion. Really, it's better to sit out 2 weeks and get better than to go right back into it and not tell anybody.
When in doubt, sit them out. Stand tall, make the right call.
For more information about concussions, visit the Washington Interscholastic Activities Association website at www.wiaa.com. Additional information can be found at these websites.